Hi, this is Linda and Aaron with Traveling Flamingo, and today we're going to be going over part 2 of our review of the EU Suggested Guidelines document. Part 1, you can check out our video. We looked at the changes that you would see as a cruiser, mainly on the cruise ship, and today we're going to be going over the policies that the cruise lines are going to have to be putting into place. So all that and more coming right up.
So to kick it off, again, this is all of the sort of procedures and processes that need to be in place based on the recommendations from the EU. And this is really important because if you think of the Diamond Princess, they didn't have any of these procedures and processes, and they didn't know what to do, and it created such a problem. So it starts off with monitor. So the idea here is to monitor what's going on when it comes to the epidemic worldwide or any pandemic, and identify what ports are available, where you can go, what's got a flare up of this pandemic, are there more cases in one area than another, and adjust accordingly. So I think in that case, you should be prepared that as we move forward, you could have an itinerary that changes, and that's just going to be based on, what's happening with different pandemics in the world at any given time.
And in terms of this, if something happens, each cruise line does need to have a written plan in case that there is an outbreak on the cruise ship. So they actually have to submit their contingency plans, their outbreak plans, to a port to ensure that if anything happens, that the port is able to follow through on that emergency plan. So they do need to have that conversation beforehand, making sure that they can dock, that the plan can be followed through on, that the arrangements are made if passengers are sick, that they can get treatment, and that there is shore transportation. So these ports actually do need to have an international airport again. So these plans do need to be written up. So it's not just going to be willy-nilly, oh, we're okay. No, it needs to be a set plan.
And I think you'll see this with stuff like your main ports, so like Miami, for instance, or Canaveral or Ada Cruise Lines, who's doing some cruises from Germany. That home port will have this plan, and in this case, the state or the country or city, I guess, will accept those plans, and they will be aware that if there is a COVID patient, they're going to be coming to Miami with this patient, and this is the hospital we're going to go to. Here's the plan that we have on file, and all of that's available, which I think will be great.
So we'll go through some of the things that have to be in that plan.
So the next area they talk about is repatriation. So this is bringing you back to the home port in the event that something happens. There's 3 different categories here. The first category is for people who do have COVID. There has to be a plan in place for bringing them back to the home port and ensuring that they're quarantining or going to a hospital, and that hospital is identified, how they're going to transport them is all planned, et cetera, et cetera. This also includes close contacts, so family members and so forth that are with you. Even if they don't test positive, there has to be a plan for what we're going to do with these contacts of people who do test positive. They get quarantined. They're going to have to wait 14 days as well because it could still be incubating, and they'll get them off at the home port as well. And there needs to be a plan for like a hotel or something for them to stay at, so they're being quarantined properly. And lastly, for people who are asymptomatic, who do have a positive test, they also need to take them to a hospital or a hotel or some sort of facility to wait out the 14 days as well, in case you do develop those symptoms. So one thing they don't explicitly talk about is who pays for it. However, they do need to be very specific about the cost of recovery and health measures in their implementation plan. So ideally, they will identify what those costs are or have prearranged costs for this happening, but probably a good call out to have medical insurance if you don't have it already, or pay for it on the cruise so you don't have to pay for any of those costs.
And I think one of the other things is those close contacts aren't just family members. They might be using the video surveillance on the cruise ship to be seeing who else came in close contact with somebody who did have a positive test. So it's again trying to limit the risk, but then if there is an outbreak, making sure that it's contained as quickly as possible. Everybody knows who needs to know, and it's not going to be like it was before where people are just waiting on the ship. No, it is getting people off, getting them off for treatment, and having those plans prearranged.
So that takes us to the next category, which is testing on board. So the CEO of Carnival had also said this, that they want to have RT-PCR laboratories on board, so they're able to do all of the testing that's required there on the ship. So those are the swabs to make sure that the the person sailing is healthy, and if there is a suspected case, they're able to test that immediately and find out, and that'll shorten the amount of time it takes from a symptom to actually having an outbreak, or multiple people with it. So if they can identify it really quick, or if you go down to the hospital really quick, they can run that test, they can find out if you actually have it, and if you do, quarantine you immediately, so you're not going around those ships spreading coronavirus.
And they also point out that it's not just relying on the testing.
Yes.
They will also be looking for other symptoms as well, because so it's not just relying on testing, because sometimes people might feel complacent that, I've had the test, it came back negative, and there's a bunch of reasons it might have come back negative. So I think that's why they're still putting all these other social distancing procedures in place, and the mask wearing when you can't socially distance, because there are reasons that it might still be a negative test.
Yeah, also one thing, a lot of people will say, why don't they just test everybody going on board? And I'm sure that's something that they could potentially do. However, the swabs don't catch it if it's still incubating. So if it's a small amount that you've got, you could still be positive. So, it does cover a lot. We always kind of get into this argument when it comes to asymptomatic people, where it's like, some people don't have the temperature. Sure, but a lot of people do. The majority of people who present do have those temperature problems. So, it gets most people, and same thing absolutely with the swabbing, that you're probably gonna get most people, but it doesn't get everybody. So you have to make sure that you have other things in place.
There's also some guidelines for training of crew for COVID, COVID symptoms, preventing, but it's everybody on the ship needs to have this training. People who come in contact with people on the shore need to have this training done as well. They actually, similar to having fire drills, are going to have COVID drills. So, making sure, and even once they resume training, so, prior to the cruising starting, they want to do these drills so that they understand and can get into action as quickly as they need to. But even once cruising resumes, people need to stay on top of this, I think, is the consensus that we're seeing, and really minimizing outbreak and making sure that what happened at the start of COVID doesn't happen sort of a month into cruising.
Yeah, and training is a really important part of that, right? You need to make sure the staff's trained. One other thing too, we talked about a lot of these plans for taking passengers off the ship. That actually does also include the employees. So part of that the training plan and the implementation plan that they have includes those employees in case they also come down with COVID, along with the ability to test on board. So just an additional thing I wanted to add there. So beyond testing, there's also mandatory reporting. So if you do find a COVID patient on board, you have to report that to the next port so that they're aware. And this will help prevent the spread. Obviously, people will be quarantined as well, so they won't be going out to that port. But you do have to sort of, radio it forward and let the next cruise port know that you're going to be docking at, that you have patients on board who do have COVID.
They've also recommended that they limit the amount of passengers on board. This is to allow extra rooms and empty rooms so that there is temporary space for isolation and quarantine if needed. So that would be space for individual isolation rooms, and you need enough for 5% of the passengers and 5% of the crew. If there's ever a time in your trip you aren't able to disembark in 24 hours. So of course, if you're doing a transatlantic trip, you're not going to be able to be in a port in 24 hours. So that means you need to be able to quarantine 5% of passengers and crew. You only need enough space to quarantine 1% of passengers and 1% of crew if you are able to quarantine in less than 24 hours. And I think that's what we're looking and seeing with the Germany cruises, is they're just going out and back for a little bit. They're probably not going to be going too far, so that they can get back in quarantine if they need to. And they're also having a maximum of 2 crew members in general in a room. So if they need to isolate, clearly that they will be taken out, but in general, no more than 2 crew member per room.
Which I think is great, because some of the older ships, they definitely pack in a lot of crew into their rooms. So, it's nice to at least give them some space, and also make sure it doesn't spread amongst crew if that were to happen. So lastly, they talk about inspections. So they're going to be having a whole new process when it comes to training inspectors to make sure the plans are in place, to make sure the ship is clean, to make sure all of these rules that we've talked about between these 2 videos are in place. And they're going to go ahead and, again, make sure they have those inspectors. The EU Healthy Gateway is going to help organize how those inspections take place. They're going to help organize making sure there are enough inspectors. And they're going to basically go through the cruise and make sure all of these things are in place, which I think, makes a lot of sense. None of this is useful if you're not actually checking for it. So it'll be good to see an increased level of inspections from a bunch of different groups. And I think it'll just make it safer for everybody.
I think also for me, when we're looking at booking our cruising for next year, you have family and friends saying, what if you get quarantined on the ships for weeks? And, look at what happened to these cruises. And well, this is the plan that you can say, hopefully, that these guidelines are followed. There is a port. No one's getting stuck on a cruise ship for weeks and months at a time. They have an agreement that this port will have the planned procedures and transportation in place, that they're not going to be in that situation again.
Yeah, I think it's great to have all of this information available. I hope these plans are available for your cruise. That would be really good. I would like to see it go a little bit further into stuff like ensuring that people can rebook their cruise without penalty, because you wind up with people who get sick, who don't want to lose their 100% of their cruise that they paid for. So they're going to wind up going on a cruise when sick. So I'd like to see them keep some of those sort of policies in place, and nobody's kind of regulated that, and maybe they can't, but I'd like to see, more or less these cruise lines keep that policy in place just for that additional safety of, if, you're not going to lose all your money if you can't make the cruise, go ahead and just move it to another date or cancel it if you need to and get your money back. I think that's a good driver of making sure people don't board these things when sick.
So we hope that you've enjoyed our breakdown of this document. It was a lot of information that we've tried to organize out for you, what you really need to know in these 2 videos. And I think that's very promising in terms of the future of cruising. So please do let us know in the comments below. Does that set your mind at ease at all about cruising? Thank you so much for watching. Please make sure you hit that like and subscribe button, and happy travels.